So hello everyone. Today's video is about me telling you guys the difference between the medicine what I did in India and what we are practicing in Australia now. So it's been almost 2 months I've been working in medicine in Australia. So let's compare. First of all, the entry to get into medicine in India is very difficult. It's very competitive, and I have seen people struggling to get into medicine for years. And in Australia, medicine is comparatively very easy to get into because in Australia, it's really hard to get into surgical branches, but medicine is quite easy to get into. So for getting into medicine in Australia, you just have to apply for your BPG training, and there is no formal exam, but there are some interviews, and not very difficult. So if you're working in Australia for 1 year, you got your general registration, you can start applying for BPG training, and you're good to go in a year. But in India, you'll be struggling for 3 to 4 years to get into medicine training. Second, the training. The training process in India is more, I would say, clinical. You'll have to work crazy, like 36 hours long shifts and bit of a toxicity in some colleges or departments. Luckily, my college was great. And yeah, so there in India, in every college, when you practice medicine, you go by clinical sense. You examine the patient from head to toe and you make your diagnosis and then go for an investigation. But in Australia, the investigations are easily available, and you examine the patient, you make a diagnosis, but you are more relying on investigations here because you have unlimited resources. So you don't have to think twice before ordering a CT, chest, abdomen, pelvis. But in India, you have to be very specific where you want to spot the disease, like is it chest or abdomen, so that you go for a specific investigation in India. So in sense of clinical examination, India, I would say, is more into clinical things. But Australia, along with that, you have got plenty of investigations available for you. So yeah, and you can get unlimited investigations, even if the expensive ones, because in India, if you want to diagnose a disease that is a bit, expensive to diagnose with expensive tests, it's really a hard-time job to diagnose it. But in Australia, you don't have to worry much about it. Third, exit exams in India and Australia, I think there's same difficulty levels. Similarly, like once you get into training, you complete your 3 years, you have to study a lot to pass your medicine exams in both the countries. But in India, if you want to go to advanced training, you again have to compete with lakhs or maybe thousands of doctors to get into subspecialty. And in Australia, getting into subspecialty is not that competitive if we compare with the Indian competitive exams. But yeah, it's difficult for intervention branches with intervention like gastroenterology and cardiology, endocrinology as well. So yeah, in India, you can just read and crack the exam and get into the subspecialty training. But in Australia, you have to work in that field. Basically, when you are doing the medicine training, your research and everything should be focused on the subspecialty you want to get into, so that you score better in the interviews. And in Australia, you don't have to go for do a thesis that is mandatory in India. That's not necessary here. You can go for case reports and stuff, but not very hard rules for thesis as such. So after life, once you are done with your training in India, right now I'm talking about medicine training, the basic medicine training in India, 3 years. You can become a consultant, you can start your private practice. There's lots of scope of medicine in India. But here, if you want to practice medicine, you again have to do 3 years of subspecialty training in general medicine to become a consultant here. And it's not like you can become a consultant after 3 years of BPT training that is equivalent to MD medicine in India. So you have to go for advanced training in medicine to become a consultant. And once you are a consultant in Australia, you earn a lot as compared to India. But if you have a good practice in India and you are practicing like as a private practitioner, you can earn equal or maybe more than that. So it depends on your skills. It doesn't matter where you are working. So yeah, life after 10 years in India and Australia. In India, you'll be earning a lot. You'll be having luxuries like you can have multiple house helps and driver and everything, because these the people who do these jobs are plenty in India and easily available. They don't charge much, so you can have a helper for every task you want to do. But in Australia, the people who are designated to do this work for you, like driving or cleaning, they charge a lot. So approximately like $40 per hour. So that's a bit difficult during your training periods like BPT or advanced training, because you earn around like $70 to $80 per hour. And if you are giving like $40 to $50 per hour for cleaning, it's not very, useful. So yeah, here you have to work. You have to do your household works as well. And once you're a consultant, then you can consider getting helpers. So yeah, so that's all about 10 years plan in Australia and India. That's all. And one more important thing about Australia, what I loved in India, like if a 70-year-old patient with cancer with meds, what we used to do, that there are not much options and we can't do much about this because the treatment is very expensive in India and very limited for the people who are living in the remote areas. But here in Australia, I have seen people with cancers metastasized in the whole body at the age of 70, and they are getting treatment and then coming at the age of like 100 with the simple pneumonia or viral infections. So the treatment and healthcare for the elderly is so good here. Like if you want to have a good future for you, maybe your parents, Australia is best in terms of healthcare, I think, if I compare it to India, because money is not an issue for the patient here. They come here and get the best treatment they should have, the best according to the protocols. Everything is systematic. You find a symptom, you go in an approach and you diagnose and treat. How expensive could be the treatment? If they need to be airlifted, they'll just put the patient in the helicopter and send to a high referral center. So this is the best thing I have experienced so far. And if you have any other questions related to doing medicine in India or in Australia, just comment below. I'll be happy to answer your questions. All the best.